should be the primary educators of their children when it comes to sex education. This is ideal. It does not always happen. Sex education is a part of many schools' coursework. Teaching students a comprehensive sex education curriculum does not necessarily give them all the vital information they really need. Shouldn't we teach kids how to have healthy relationships and abstain from sex until marriage? It can be done, and that should be the goal. 50 years ago, the girl abstaining from sex was the good girl, saving herself for marriage. Abstinence was morally the right thing to do. But today in classrooms across America, abstinence has been redefined as not just a moral decision, but as a matter of public health, the only sure way to avoid pregnancy and sexually transmitted diseases. When discussing the matter of morality, decency, and education when it comes to the future of our children, my opponent brings up many legitimate points and important areas for us to consider. We are in an era when we have too many adults seeking validation for their own bad behavior by pushing kids to be sexually active or engage in dangerous activities. In 2010, Congress voted to cut $99 billion in federal abstinence education funding and increase funds for contraceptive-based education initiatives. It is vastly important to realize that researchers have found that the probability of ever having sexual intercourse following abstinence-only sex education program was 33.5%. And the likelihood of engaging in sexual activity after a birth control sex education program was 48.5%. Personally, I do not see anything threatening or irrational with positive results like that. Researchers and educators teaching abstinence are not necessarily preaching and drilling into young minds to wait for marriage or to criticize using condoms. Instead, these abstinence education programs focus on a realistic look at the sexually related issues teens are facing. That 34% of teenagers have at least one pregnancy before they are 20. Are condoms and other forms of contraception 100% effective? Absolutely not. And what abstinence education programs offer is the most logical and the #1 method to preventing teen pregnancy: abstinence. What these programs offer is the chance for students to go home and learn more from the values, morals, and lessons from their own parents. These programs allow the parents at home to decide what information they want to provide for their children. Today, researchers at the Federal Centers for Disease Control and Prevention found that at least 1 in 4 teenage girls has a sexually transmitted disease. The most common of the diseases cause cervical cancer and infertility. Again, methods of contraception do not prevent chances of obtaining an STD. Abstinence education programs do not preach that they must wait for marriage. It is not the role of the teachers to communicate that to their students. Rather, they teach and stress the importance of waiting and that sex is serious and something that can come with serious consequences that can alter their entire lives if too careless. So what is the message we send? Abstinence is the one sure way to avoid teen pregnancy and sexually transmitted diseases. Parents are then given the freedom to raise their children without state-imposed values. As I previously stated, the government spends roughly $12 to promote contraceptive sex education programs for every $1 spent on abstinence education. Abstinence-only education saves the government money, and it saves the lives of our future leaders of our country. Teen pregnancy costs the United States $7 billion a year, not to mention the cost families are risking to provide for unexpected pregnancies. The consequences families and teens face due to pregnancy and sexually transmitted diseases are immense. So why would we, as the sole providers of information, advice, and hard facts, want to support any method other than the only single and sure method that prevents families in the country of their hard-earned money? The only method that prevents teenagers of living a sheltered life, worrying the way matured adults shouldn't even have to worry. The only method that keeps teenagers from contracting diseases and very possibly spreading those diseases. Teaching students that having sex is okay as long as we're wearing condoms is misleading. Yet it's portrayed constantly in sex education programs throughout the country. With STD and AIDS being battled every day around the world, why wouldn't we start with the youth of America and try to eradicate the spread of disease that kills roughly 1.8 million people a year? The decision is in your hands. It takes one person to stand up and to make a difference. So write your mayor, governor, and president to stand behind and support abstinence-only education programs.
Okay, so the United States ranks first among developed nations in rates of both teenage pregnancy and sexually transmitted diseases. As my opponent stated, there are